We are so lucky to have Ricky on with us today.
Thank you, Jody. Thanks for having me. I am excited and thrilled to be here with you all. Thanks for joining me, whether you're joining on your lunch hour or you're joining at a different time and later watching this recording. It's great to be here with you. So I'm so excited to partner here with the Mid-America PTTC and offer this training. This topic is one that I have found has really taken people's interest because I think that conceptually we have all understood or assumed that there's this connection between social media, mental health, and substance use, especially with our young people. But what I sort of guessed, I then went into the research. I did a deep dive into research, and we'll be sharing with you some data and some information and some resources that really confirm the fact that these all do intertwine and overlap. And that intersection is where we really find that there's a lot of risk. There's a really high risk, especially for our young people. And so we'll get into this here today. So as she said, yeah, I'm Ricky Barton. I have my own consulting company. I'm actually coming to you, and my email will be later in the presentation too, so you can get with me there. This is just one of those security checks, like, are you on the airplane that's flying to where you want to fly? Is that the girl that's talking to me? Yeah, that's me. I'm Ricky. But I'm coming to you from Pittsburgh, Pennsylvania. This is somewhere I have lived only for a year and a half now. I'm actually originally from central Pennsylvania, but have lived and done prevention work in both South Central Louisiana and then Southwest Missouri. So my bulk of my prevention experience was in Southwest Missouri. And so shout out to the Mid-America PTTC because I've worked a lot with them for the past couple years since their inception. And I've been in this field for over 16 years now. And this field of primary prevention is one that is near and dear to my heart for a variety of different reasons. But to sort of just let you know briefly who I am outside of maybe this work, and then we'll get into this. I like to do some pretty courageous and bold things like climb big mountains. And by big mountains, I mean very big mountains. So if you've ever met me, you've probably heard me tell some stories and tales. The picture on the left is me at Everest Base Camp about a year and a half ago, almost 2 years ago now, which is wild to think that that adventure was nearly 2 years ago. And then that second picture there is actually just earlier this year, the end of February, I climbed Kilimanjaro, which is called the Roof of Africa. So that was a really neat experience too. Honestly, that was the hardest thing I have ever done is climb Kilimanjaro. Everest Base Camp was a wonderful experience. It was also very difficult and very trying and challenging, but offline, we'll have to talk about how hard Kilimanjaro was, but it was great. Also, I can never give a presentation without letting you know that I actually happen to be the wonderful owner of the world's cutest rescue dog. That is Oreo. She's here in the background with me, and she's always a part of prevention work. She could probably do these presentations for me now. She's heard them so many times. But getting to the heart of the matter and the things that I love to do. This picture really encapsulates my passion, which is young people, keeping young people safe, keeping them healthy, helping them to thrive and become leaders in their own communities, in their own world, among their peers now, and then we want them to be leaders in the future, but they truly are leaders now. So this picture's a little bit of a Where's Waldo because I am somewhere in that sea of 300 youth in New Jersey talking to them actually about this very same topic. This topic is one that I've presented to adults but also to young people. And it's a different presentation that I offer to young people. We talk about how to mold your environment, your online space to be safer, not only for you, but to also create a safe space for your peers and how to navigate changes in that online space. And so that was an experience that I had and absolutely love working with young people. One of the things I am thrilled for is I get to be one of the trainers with CADCA on their youth and their adult side, but that youth side is just super exciting. So if any of you will be at CADCA, I'll be hanging out in that youth side. Make sure you come and find me and say hello. All right, enough intro. Let's get into this topic today because truly, I could spend a couple hours unpacking all of the information. What I'm going to do for you is start with opening just on the facts. What are the facts about each of these three main topics? What do we know right now? And then look at the overlap. And some of that will be some data, some of that will be some research. I've got two really great resources I'm going to share with you throughout the presentation, and of course, get you access to those at the very, very end. But then we're going to sort of land the plane, at least on starting the conversation about how we make an impact in this space. And that impact will be both for you as a professional, so working in prevention, working in your community with young people, with parents, with school districts. How do we start making an impact there, but also in your personal life? Whether you are a parent, you are an aunt, you are an uncle, you are a neighbor, whoever you are, wherever you have young people who may find you to be a trusted adult, we've all got an influence and a way to make impact in this space with young people. So we'll talk through that. But I always like to start this presentation with this fact that social media is not all bad. And I think we have to start here because we can tend to talk a lot about all of these negative impacts and all the negative things that are on that space. But the truth is that we are way more connected than we ever have been, probably in the history of mankind, other than maybe when it was, like two people, Adam and Eve, walking around. Like we're so connected. I was able to be on the top of Kilimanjaro and come down that mountain and get on Instagram and message my family and let them know that I was okay and that I survived it and that I did it. We're so connected with people and loved ones around the world. We're able to get connection, at any time of day. And there's pros and cons to that, but that is a fact that we're way more connected. There's also just ways that it makes us laugh. I put a meme up here that's, humorous because we've probably all been there where, you put a lot of work into an email and then they say, let's hop on a call. But love language, I feel like the sixth love language is now sharing reels and memes with your friends and your loved ones because that's pretty much all I do is send those back and forth and laugh about them together. So it makes us laugh. It gives us these new perspectives, new ideas, new information, provides support. And that could be because you have a hobby that you really, really love. For example, I'm a sourdough bread maker, so I follow different sourdough influencers and I get ideas and inspirations from their recipes. So I've got support in that way. It could also be support from issues that you might be experiencing. A lot of these companies have algorithms that flag keywords that may indicate harm to self or others, and that will send a message about the 988 hotline number and how to get contact with trusted professionals to talk through issues. So support is there for people, and they've got access to that in increased ways. Different ways that we can be creative. And what's really interesting, one of the resources is the first time you'll see me mention this. There's a document that SAMHSA released last year, the Substance Abuse and Mental Health Services Administration. And they released this document last summer. And it's really, really a powerful, it's quite lengthy. It's quite a hefty document. But what they found in that, one of the pieces of research here is that actually for youth who are marginalized, are experiencing mental distress, social media is actually very connecting and very helpful for those experiencing that in several different ways, likely for the things that I just mentioned. And so we have to hold this space that social media is not all bad. Because guess what? Our next 51 minutes together are going to be us talking about how there are consequences. There are ways that it's showing up really poorly for us. So we have to hold this space that it's not all bad. It's not about doom and gloom. It's not about get rid of all of it. We've just got to figure out how to navigate this new space and this new environment so that we can make a difference and keep our young people safe. So I'm going to start with talking about just some of the health consequences and some of the overarching consequences we know exist because of this online space, and then we'll get into those specific topics. So first of all, just from a very biological, physiological point of view, our eyes and bodies are being strained. Until the last really 15 years, we have not, as humankind, ever had a screen that we're staring at 6 to 8 inches from our face, from our eyeballs. And so our bodies are having to adjust to this new thing. You've got this screen right here. Most people do not have great posture when they're on their phones. I've never seen anyone with perfect aligned posture where their shoulders are back, their neck is straight, and they're texting up here. Usually we're slunched, we're hunched over, we're talking down. We've got that kind of posture. So it's creating this negative impact on our bodies. We've got sleep deprivation issues. And then you'll see this come up later as well. We're up later. If we were honest with one another and we had a show of hands here, how many people have stayed up later than you should have in the past week because you were scrolling your phone? My hand would go up. Last night was one of them. I was in bed, but it was about 30 minutes later. I was finally turning off the light because I just got into a scroll thing. So sleep deprivation and the issue of us waking up in the middle of the night. We might want to check our phone to see what time it is. Oh, but guess what? I have a notification. Let me check that notification. Oh, now all of a sudden I'm on Facebook. I'm on Instagram. I'm looking up things again. So we've got this issue of sleep deprivation. With young people especially, we're seeing increased risk of obesity and type 2 diabetes. We're starting to see they're studying the brain and the impact that technology is having on the brain, that it's shrinking some of those cognitive processes sort of reducing the ability to concentrate, memory, impulse control. And with young people, we already understand that their prefrontal cortexes are still in development until their mid 20s. And so that impulse control, that cognitive thinking, really important for those stages that they're at, especially because they're learning during that time. And we're seeing that delayed learning, especially in language development. Could be because of some of the slang and the lingo, could be because you typically don't text as much as you might say. And so we're seeing some delays there. But speaking of learning, this is something that ironically I did pull from a Facebook post. So, we'll say that with tongue in cheek. But this next slide I'm going to show you, a teacher put up a flip chart paper. And she said, "All right, students, turn on your notifications. I want to hear every sound. I want you to make sure for the next hour, every notification that comes in, we see it. Turn your volume up. And then come up here and put a hash mark on this piece of paper for every notification that you receive." This, my friends, was the result from one class period that a teacher facilitated that activity. So for those of you who can't see, I'll use my cursor over here. Top left is Facebook notifications. The middle here is Snapchat. This is email on the top right. This middle is all text messages. So that's the bulk of them, this text messages right here. Phone calls, which I'm like, who's calling them? Probably you, probably parents, probably guardians. Phone calls. Instagram is here, also pretty popular. Instagram, Twitter or X is over here. GroupMe and Discord in the bottom middle, and then other likely gaming notifications, things like that. And so we can sit here and we can be aghast at this, but the truth of the matter is, if you all took a sticky note next to your desk one day and you did this activity, of course, it wouldn't be as many because there's not 30 of you. There were 30 students in this classroom, but you would likely also be shocked at how many notifications come into your phone. Because guess what? These phones, and especially social media, are designed to train our brains to respond to and to actually crave notifications. So all of these push notifications that we give permission to come through our phone are actually training our behavior. They're training us to want to look at them, to engage with that notification, to engage with that thing. And so we are becoming addicted. There's a socially acceptable addiction to our phones, to social media, and there's actually some brain science coming in behind that. This image comes from the National Institute for Drug Abuse, NIDA, and they do a lot of research around the brain and substances and the influence there. So what this image really just shows is that first image with the blue and the orange, the few little orange bubbles, is showing your dopamine receptors in your brain. And the little orange bubbles are the dopamine. And so it's just showing that, you've got dopamine in your system, but when you have food, which is what this first image is, some of you may be at your desks eating food right now. Your brain's firing, getting some dopamine in there. Like, man, we like this. This is good for us. We should do this again sometime. It's a reward center. It says, hey, food's good for me. It gives me energy. It makes me feel good. I like the taste. So, hey, I'm going to want this again because it's good for me. That's the beautiful thing about our bodies. It helps us to know exactly what it is that we should keep doing. Well, unfortunately, we see the same effect in the image on the right there. All of those orange bubbles are the dopamine when an individual has cocaine in their system. And so this helps us to see the flood of dopamine that happens, which is that high that substance users seek. And so the brain science behind that addiction is then we decide that we want more of that, and then we become a reliance and a dependence. And then substance use disorder may be the diagnosis as that journey progresses. So this is likely not a new journey for all of you. However, I point this out because, like I said, what we know is that the brain is doing exactly this when it comes to our social media usage. It's providing this same dopamine rush. Anytime, if you wear a smartwatch, you're really hooked up to a dopamine administrator because every time that little vibration happens, what do? You look at it. What is that? A notification? What do I need to do? Or your phone goes off. Maybe you don't wear a watch, your phone goes off. What's that notification? I got to go look at it. And so it's creating this reward system. And there's this really interesting phenomenon, and some of you may acknowledge that this happens to you too, where you may not have received a notification for a little while. What's the behavior you typically do? Tap your phone. Just check. Just a quick check. It's almost a subconscious check. Because somewhere in your brain, you're thinking to yourself, man, there must have been a notification that I missed. I'm craving that dopamine. I want that. Well, if there's no notification, I may actually feel sad. I may actually feel a little bit bummed about that. So then maybe what I do is I pick up my phone, I open the phone, I unlock it, and I go to one of my favorite apps, whether that's a game, whether that's Facebook, Instagram, Snapchat, wherever you might get your fix. And if there's nothing there immediately for you, you start scrolling because again, your body's craving that dopamine. It's a fascinating, fascinating idea. So this issue is true for us as adults as well, but we've got to think about this from the perspective of a developing brain of a young person, that their brains are literally being wired at this time. They're going through a major pruning process in adolescence. There's two major pruning processes for the brain, time periods for the brain, young toddler age, and then this like adolescent period. And so as they're pruning and the neural pathways are figuring out what to keep and what to get rid of and what to strengthen and what to weaken, they're being paired with this behavior with devices. And so we have to just be aware of that addiction cycle. Now, before I get into all of these different topics, I'd love for you to open up your chat. I've talked about just a few of the positives and negatives, and of course, we're going to get into some more of these. Where have you seen social media have an impact in your life? Could be good ways that maybe you're in touch with a kiddo from overseas, or maybe that, you're able to see how it does sort of dominate parts of your life and you have to tell yourself to put your phone down. So in the chat, I'd be curious for you all just to drop some of the ways that you've seen social media impact your life. Connect with family members more often. Yeah, staying connected. I've seen lots about connection, creativity. Love that. Yeah. Ooh, and FOMO. We're going to talk about that, Sam, that fear of missing out. Yes. Over shopping. Chandler, I agree. Man, I'm getting hit with ads all the time, and it's very much like, oh, well, I've never heard of that product, or hey, I actually could use that more of that. Yeah. Impacting attention span, absolutely. Having that sort of short, I have a shorter attention span. It's not, and my brain has been fully developed since social media existed. I was one of the OG Facebook users in college, but otherwise it was, but it's still impacting my attention span for sure. Up to date on news, absolutely. It's where most people get their news these days. Yep, lots of people staying connected with people across the world, lots of time, especially at night scrolling. Yep, yep, time wasted. Knowing what's going on in your community. I'm in my neighborhood group on Facebook and I make sure that I check in on that. Yeah, bringing different communities together, getting different perspectives. Yeah, seeing different things. But on the flip side of that, some doom scrolling. Oh, I love all of these. Thank you all so much. I'm scrolling as fast as I can to keep up. Oh, I love that DIY products for crafts and for weddings and things. Absolutely good. And that last comment there by Nicolette. Yeah, grew up comparing myself to others on social media, and we will talk about that. Absolutely. There's this culture of comparison that we see online. Thank you all for sharing that. Keep those just in sort of your space as we're walking through the next couple here, couple slides as we dive into talking about these each one by one. So just to sort of orient you or anchor you, I'm going to talk about these three individually, and you'll see them in bubbles on the top right corner. And then as we get into the interactions, those bubbles are meant to just sort of help guide you as you are following along with us today. So we'll start with mental health. And it goes without saying, but I will say it, that we do definitely have a mental health issue happening across our nation where 1 in 5 individuals, young people, adults, will experience a mental health challenge in this year. It could be for a temporary period of time. It could be something that leads to a diagnosis that requires treatment, but 1 in 5. So we have a issue here with mental health challenges that are hopefully receiving help, but many go undetected for a longer period of time. Suicide is the second leading cause of death for 10 to 14-year-olds, third leading cause of death for 15 to 24-year-olds. And we understand that there's a big burden. There's a big burden on society and on individuals in terms of depression, anxiety, these disorders that are creating a lot of problems. Individuals that can't work because of them, individuals that maybe aren't enjoying the fullness of life because of them. And so that mental health issue is there. Since we're doing this kind of in a regional, I didn't grab any state level statistics for you all, but just understanding from a national point of view that this 1 in 5 and those suicide rates are something that we really want to pay attention to. We'll talk more about that when we get into these interactions. This is just meant to orient us to the idea that we've got some issues going on here. Similar with substances, we understand that cannabis, nicotine, and alcohol are the top three substances that are used by young people. And specifically, the Monitoring the Future data from 2023, I listed here. And I made sure to include the vaping of marijuana and nicotine because we see those are, pretty high and they're increasing in that way. Overall, trending since really COVID and the pandemic, we're seeing nationally substance use trending downwards among youth, which is a great thing. We want to make sure that we are tracking that information and keeping a pulse on it. But we still have an issue here where, right around 1 in 10, a little bit more than 1 in 10 of our US 10th graders, and this is just 10th grade data, are using alcohol, using marijuana, and vaping nicotine. So we do see other nicotine uses being pretty low. That's great. But we want to keep a pulse on that, but also understand that vaping's a big issue. And I point back to that image of the brain and the science of addiction and how all of that process works, where the brain is becoming more reliant on those substances, especially as it's developing. So this is an issue we want to keep tabs on as well. Now, you may have already known a lot of that. You may have walked into this webinar. You work on substance use prevention or mental health promotion, so those may not be new to you. Some of these next slides may be new for you. Let's talk about statistics and facts around social media. About half the world's population has a social media account. What I want to draw your attention to here is that 95% of teenagers have a social media account. 40% of young people 8 to 12 years old use some form of social media. Now, mind you, the technical legal age for having a social media account is 13. But we've got almost half of our 8 to 12-year-olds with a social media account. This is dangerous, y'all. The platforms are not built to have young people that age on these platforms. There's not enough safety and security and kind of regulations around these for young people to be exposed to the things that are out there on social media. So this is dangerous. This is one of the first flags of danger that we're really seeing with social media, is that we've got so many people 8 to 12 years old on social media. And the fact that nearly every teenager has some form of social media. And we'll get into more of that. And again, that statistic comes directly from that SAMHSA document that I'll share with you at the end. Megan's going to pull up a poll for us, but before we get into a few of the more statistics on social media, I wanted to see what you think. How much time do you think you spend on social media every day? And be honest, this is anonymous. If you want to go ahead and pop that poll up, Megan, I would just be curious to hear. I put in less than an hour, 1 to 3 hours, 4 to 5, 6 to 8, or over 8. Let's see what everybody thinks here. Too much in the chat. Yeah. Agreed. All right, I'm seeing a slowing of the poll takers. We'll just give it another couple seconds here. 100 of you have responded so far. Also, just as a little bit of a hint and a plug here, if your phone is near you, you might want to grab it. The next slide, I'm going to ask you to grab your phones and be ready to look something up real quick. All right, let's go ahead and end the poll there and we can share the results. Very interesting. So the majority of us are in that 1 to 3 or 4 to 5. That's the bulk majority that we're saying, yeah, we spend about 1 to 3 hours and 4 to 5 hours. We've got almost 10%, 9% that are 6 to 8 hour range, just a couple in that over 8, and then just about 10% in under 1. Also, I'm realizing my typo there. I said 1 hours. So that's on me. It's just 1 hour. Okay, great. Okay, really interesting stuff. All right, now what I'm going to invite you to do, let me get to my next slide here, is I provided instructions for both Android and iPhone. Follow these instructions if you would. Go into your settings and look up your screen time. And just see, generally speaking, what kind of total it gives you for your social media. Now, you may need to add the Facebook app, the Instagram app, the Snapchat app, the TikTok. You may need to add those up really quickly. Just give us a general total in the chat. I would love to see some of you start dropping that. Just looking at dogs count. I love that so much. You know what? I feel like dogs cats, animals, they should just be, they're really just for those happy feelings, the happy endorphins. So I think that that's great. All right, I'm seeing 6 hours, 4 hours, 3.5. Hi, Julie Hook. Um, let's see. We've got, yep, 1.3, 4. Wow, yeah, okay. Yeah, they're going faster than I can read them. But you were about right. So I'm just curious, to know, and you don't necessarily have to put this in the chat, but just considering, given what you said in the poll before, is that different? Was it more? Was it less? And some people are very much not on social media, and that's great for you. There's other people who are on it all the time. So this is not a shaming, blaming kind of situation. This is just information. Isn't that what we do in prevention? We provide information and then we have the choice. Then we have the behavior change choice if we so choose. So this is the work that we do. It's just helping us to become very aware. We're raising that awareness. All right. Great. Thanks, Kristen. Okay, so let's just take a look at this now. So on this next slide, I've got kind of a national average that's happening here. So US adults, someone did some math, someone way smarter than me did some math and said that basically as adults, we'll spend about 44 years of our lives looking at screens. Now, this is just maybe a little self-over disclosure. I have not lived that long yet. So for me, I'm looking at doubling my life of like from here on out, looking at screens the rest of my life. That's like a wild notion for me. That's a very interesting concept. And that can include TV screens and things like that, but that's still pretty wild to think about and to consider, especially the fact that 20, 30 years ago, we didn't have computers like we do now. We didn't carry laptops around with us. We didn't, we like might have had a laptop that we used for our schoolwork back in the 2000, but it wasn't like you had a home computer and maybe you were on it for a short time. At least that was my experience with my family. And so this is a really newer concept when it comes to humankind. So I can't share total screen time, it's too high. Yeah, it is a little bit startling when you look at those numbers. But as you see here, the average American adult is spending 4 to 6 hours a day on our smartphone, meaning just whatever we're doing on our smartphone, but about 2 to 214 is on social media. I think that number is personally very low because as you all are sort of demonstrating, it's more like 4. It's more like that. Then US teens, about 9 hours a day on screens. 3 to 3.5 are watching videos that can include TikTok and YouTube, and about almost just shy of 2 are playing games, and about 3.5 are on social media. And so I want us to anchor that. I have that asterisk there because I want you just to hold space with that fact right there. I'll come back to that in a little bit, that 3 hours and 30 minutes that young people are spending on social media. Okay, so we'll come back here to this. So continuing and rolling out some stats here. By age 10, almost half of our young people have their own smartphone, which also then kind of aligns with that 40% of 8 to 12-year-olds that have social media accounts. Average screen time has increased by about 50 minutes in the last 13 years. And my friends, I don't know how we didn't switch to a 25-hour day. We still only have 24 hours, but we've lost one of them to screens. That's really a kind of a strange concept to me. And then here's just your top 5 uses for social media. Social interaction, which many of you said, many of you put, that was your reasons, like the positives, you're connecting with people, you're able to talk, the news, information seeking, you're passing time, that entertainment, because we're watching dog and cat videos, we're relaxing. These are these top reasons why we are using these. Claudia, I'm just seeing what you put in the chat about being on the plane. I have noticed that on weeks, because I travel a good bit and do a decent amount of traveling for my consulting business, and I've noticed when I'm at a conference, my numbers are down. When I'm home at my desk, my numbers are way up in that week because it's like it's available to me. It's right here in front of me. And I apparently pick it up and interact with it a lot more when I'm sitting at my desk than I do when I'm out and about. Let's take one more poll. Let's just see which apps do you spend the most time on? And this could be based on what you just looked on your phone. It could just be you shouting out what you think yours are in the chat. Are you on? Okay, so I'm seeing TikTok right out the gate. Just kind of curious. I'm going to show you what young people do. Great. Yep. Okay, so I saw a game in there, but mostly TikTok, Instagram, YouTube, Facebook. Yep. Oof, Amazon. Yeah. Tell you what, I'm always ordering things on Amazon. Mary Elizabeth, I love that for you. You don't have any. I love that for you so much. All right. So given what you all are saying, that's pretty on trend. lots of adults on Facebook, on Instagram, on TikTok. And I'm not seeing a ton of Snapchat, which is also pretty aligned, but there are adults who have Snapchat accounts, but that this is aligning pretty well. What I'm going to show you next is what young people say. So in the US, young people, top number of apps used are YouTube, TikTok, and then Spotify, which I found really interesting. And when I've talked to youth, they often push back and they say, well, Spotify is kind of not really like an app we think of as like social media, like or like an app. Like we just sort of turn on music or a podcast and then we go do something. I'm like, okay, that makes sense. So they argue that Snapchat should be the third one. But top apps by number of minutes used daily by young people, TikTok, YouTube, and Roblox, which is a gaming app. But there is a social media component to that. There's chat features and there's ways that that is actually still social. So this is really interesting. Whenever I do present this to youth, I first pop up a Mentimeter and I ask them to fill out a poll and rate that. And usually this is pretty accurate in terms of their responses to it. But like I said, usually Snapchat does come up as one of the top there. So that's all some interesting information. A lot that we could do with that already. But what we need to look at is where we see this interaction take place. In the center of this interaction, where we see the danger really lying. So let's look at these kind of in pairings between all three of these. We'll start with drug use and mental health. Kind of looking at this from two different ways. The first way being, we oftentimes use substances to cope with mental illness or mental challenges or mental distress. That could look like I'm feeling really anxious about going to see my friends, so I'm going to drink or I'm going to smoke or vape THC to calm me down. Or that could look like, the coping because I'm feeling down, I'm going to drink. That all of those coping mechanisms that happen there. The flip side of that, or the other way to look at that, is that actually substance use, the interaction here could look like substance use leads to mental health challenges like depression, anxiety, aggression, hallucinations. We're seeing this happen, and there's longitudinal studies showing this connection between heavy, consistent marijuana use in adolescence leading to an increased risk of the development of schizophrenia in young adulthood. So we see this connection between substance use and mental health challenges from these two different ways that is very, very dangerous for our young people. Specifically, and I actually, because I lived and worked in Missouri for so long, I've got access to their data. And I did a little bit of a data poll for Missouri young people. The high school students who reported that they were seriously considering suicide were far more likely to either use or misuse substances in the past 30 days, to the tune of, I'll just say it a little bit clearer and make sure you understand this. High school students who seriously considered suicide were 3.2 times more likely to have used alcohol in the past month, were 3.4 times more likely to have used marijuana in the past month, and were 12 times more likely to have misused prescription medications in the past month, compared to their counterparts that did not seriously consider suicide. So this data for me really illuminates this connection between drug use and mental health and the risks that are associated with that. Now, this next data slide, and I would just say if you're in a different state than Missouri, you likely can find data from your student survey that would help you with your local numbers as well. But hopefully that helps to see that, because the connection here, this is national data and it is a little bit old. I actually have been struggling to find an update on these numbers, but the point being that we see a number of suicide deaths connected with intoxication of some kind, with some substance in their system. So as you can see here, I won't go through all of them, but you can see here the rates of the numbers of individuals who had these drugs in their system at the time of the suicide attempt. And so this is really, really relevant to what we're talking about here in this dangerous interaction where substance use, mental health can really create a increased likelihood of seriously considering suicide and potentially attempting that suicide. So we hold this space for that heaviness of that interaction of young people. We'll shift to looking at this interaction of social media and drug use. Columbia University did a study that found that simply having a social media account, which remember, 95% of teenagers and 40% of children 8 to 12 years old have one. made them more likely to use substances, 5 times more likely to buy cigarettes, 3 times more likely to drink, and 2 times more likely to use marijuana. Just having a social media account. That does not that does not say the question was not about whether or not they're looking up how to smoke weed or looking up how to drink and what to mix your drink with. And it wasn't anything about searching for substance use. It was just the fact that they had one. Followed by this next point that for the young people who are seeing photos and stories and videos and content around young people partying, did make them curious to experiment in that same way. So there is this direct connection between what they're seeing online with substance use and their interest in pursuing that themselves. We also know that social media is becoming a common source of them accessing substances. I would venture to guess that any of you could walk up to, say, 10 or 20 young people in your community, and at least one of them will be able to tell you the Snapchat account in your area of the person to message if you want to get some fake pills off the internet, if you want to get some marijuana. They'll likely be able to tell you that because there's oftentimes someone in the community that they all know that that's who they can go to. So we see social media as this new way to access substances. Then, talking about advertisements here, one of the primary prevention strategies is to address price and promotion. We've done this for years with alcohol and with nicotine and, kind of getting into this world with cannabis dispensaries, where we're looking at how promotions of these substances influence people's behavior. So we're asking, please take your signs down out of the windows so that when students walk by, they don't see all the alcohol bottles and the sales and all of that. Well, that's really great strategy, but social media can be really hard to regulate some of these ads. This will come up later in the recommendations that I'll get to, but one of those things is to say, hey, maybe we need to start regulating these ads better, where maybe anyone under the age of 16 or 18 doesn't get any advertisements at all across the board for anything, because it's just one of those, like, why target ads to those young people? And as someone's saying in the chat, yeah, we're susceptible to buying the products that we're getting. I do it as well. I mean, it's just the stage of life that we're in, where we were getting inundated with ads that are appropriate for our interests. They're watching, they're the algorithms tracking what we're clicking on, what we're saying, what we're interested in. Shifting now to thinking about this interaction between social media and mental health. Again, likely these are things that you've assumed, but some of this research helps to corroborate this. We're seeing this connection between social media and increased anxiety, depression, and loneliness. Someone mentioned FOMO and comparison in the chat. And that fear of missing out. I'm seeing other people do this. They went on this vacation, or they're at this party, or they're doing this thing, or so and so was over at so and so's house and they're posting YouTubes and TikToks of them dancing together and I wasn't invited. All of these create this culture where we can feel like we're really isolated, like we're left out, like we're not in with the friends that we thought we were in with. We've got this reduction in face-to-face contact, which is impairing our social skills, the development that's there, as well as creating increased isolation. And as it says here, this British study, just again, the idea that social media is creating disruptions in sleep, and sleep is so important to our bodies, to our minds, to our abilities to learn, to remember, to interact well with the people that we love. And so all of this is influencing our mental health. We also know cyberbullying is a major issue these days. You've probably heard it said, back in the day, you could avoid the bully on the way home and then you were free for the night until you show up at school the next day. Now it's all night long. It's constant barrage of exposure to either bullying of yourself, bullying of your friends, or watching others be bullied. And honestly, y'all, as adults, we're pretty bad about this too. We're pretty bad about it. We're pretty brutal to one another online. We're not modeling behavior very well for young people when it comes to how we interact with each other online. So I think that we have a lot of work to do around that. You'll remember that I told you to hold space for that statistic that about 3.5 hours of time our youth are spending on social media. Here's where this comes back into play. The former US Surgeon General Vivek Murthy, he put out another document that's a resource I'll share with you at the end here. And he found in his research that students who spend 3+ hours a day were twice as likely to experience poor mental health outcomes. So if we've got the majority of our youth spending 3.5 hours every day, that means the majority of our youth are in this statistic. that they're twice as likely to experience poor mental health outcomes. Young people are seeing a lot more hate-based content, a lot more violent content online. And going back to these targeted ads, they're oftentimes producing misinformation, inaccurate information, and the way that the algorithm works is it boosts things that get attention. And violent or absurd or very enticing things are what gets promoted. But the danger here is that a young person, as I put an example here, a young person might say, "Hey, I'm really interested in eating healthier. I want to, make the team next year. I want to just be healthy for me." So they might do some searching, but they may end up with content that actually glorifies eating disorders. But because they're not familiar with that, they may start following some of those things and it becomes really, really unhealthy for them. And that's just one example of ways that these targeted ads can become really, really dangerous for our young people. And I mentioned Dr. Vivek Murthy. He actually, towards the end of his tenure in that position, he issued this statement in an op-ed piece where he said, just like cigarettes have warnings about causing cancer, just like alcohol has to have a posting that if you're pregnant, you shouldn't drink, we should have warning labels on social media that say this is dangerous for our young people to be a part of. And I feel like this is a pretty strong statement coming from someone who holds that high of an office for health and the well-being of the American population. For him to say this, I think is really important. And again, I've got his document at the end of this for you all to be able to look at. So again, our last kind of piece here in thinking about mental health and social media, the more time we spend on social media is also connected to increased negative outcomes. So if I pick up my phone, I'm on there real quick, I put it away, I move on. Okay, low harm, low risk. The longer I'm on it, 30 minutes, 60 minutes, 90 minutes that I'm on that, the higher that likelihood becomes. And when I speak with young people about this, I oftentimes tell them, do a body scan, do a body check when you've been on your phone for a while. How are you feeling? Is your body slunched? Do you feel like a pit in your stomach? Do you feel like you're not breathing deep? Does your neck hurt? If these are the sort of things your body are starting to tell you you've been on it too long, and there may be some issues that are popping up there. We are impacted by these interactions, whether we as adults want to admit it or not, we are, but also young people. If they don't get the shares, if they don't get the likes that they were hoping for, that can create a really negative space for their mental health. And then finally here, this point is so interesting to me. I'm curious to see as they continue to research the brain and how all of this is influencing the brain. But they're starting to look at how filters and angles that are so popular these days actually might be influencing the developing teen's brain's perception of reality. And don't mishear me. They're not saying that they think that the Snapchat dog ears and dog tongue are real. But the beauty filters, the angles that they're being taken at, create this distortion of what's real and what's not. And that can create a lot of confusion for that developing teen brain. And this is where I'll just drop this. I have a whole other session I can talk about with AI and the influence of AI. But let's just talk real quick about this. And this is going to put us adults on blast because once again, this came from Facebook. It was probably about a year and a half ago. I was scrolling and I kept seeing this one picture over and over again that people were sharing. And they were sharing this gorgeous picture of a baby peacock. I already see it. It was beautiful. Maybe you're gonna be familiar with it. Everybody was sharing it. Everybody go, "Aw." I mean, that's a cute baby peacock. Am I right? Like, look at it. It's got swirly eyes. It's cute little feet. Your brilliant blues and greens. And I just remember sitting back looking at this, that I had probably seen it shared 4 or 5 times at this point. And I was like, I just feel like in my lifetime, if a baby peacock looked like that, I would know it. Like I would have known this is what a baby peacock looked like. So it took me about 2 seconds to pop over to Google. Google up, what does a baby peacock look like? Google images. Y'all, this is a baby peacock. I mean, he's still cute. Okay, he's still cute. He's cute little, but he's not brilliant blues and greens with swirly blue eyes and a cute little it's not the same. And so we as adults are actually really bad at detecting AI. Well, I've noticed this about us. Young people are actually great at it. They're better at it than we are. They're almost well versed in this like ability to say, hey, that's AI. But what's interesting about that is they're using AI more to sort of, create things. And so I think that this is something we've really got to keep a pulse on. So if for the sake of time, I'll keep moving. I've got more stories to share, but I really want to get to some solutions in our last couple minutes together, and then be able to make myself available, if anybody does have any burning questions to add. But I just think we've got to be really careful here. So to kind of bring us to sort of a place where we can start to do some things about this interaction, I'll just share this slide here, which has a list of different signs to look for. So if you are working with young people, have young people in your life, are a parent or a guardian, these are things you can start to look for that might show you that we're starting to see some issues develop in this interaction, in this overlap of these three topics where we're thinking about our changes in behavior, changes in mood. Some of this is typical adolescent development, but some of it could be a sign or indication that we're having some sort of interaction happening here. So those are there for you, and I'll make sure you've got that list at the very end. But my point being, given all of these dangers, we've got to do something to this interaction. And as I was doing this research, I kind of felt like, man, there's not really a really simple way to address this. If I could give you a boxed up packaged thing that says, hey, this fixes all of the issues related to social media, mental health, and substance use, man, I would be making millions because that's what we need in our world right now. But the truth is it requires work that comes from prevention communities, from people who are out there doing the hard work, working with young people and parents. And so all of these solutions I'm about to share with you really come from a variety of different sources. Prevention science to begin with, and I'll share that in just a second. But also these two documents I've been referring to, that SAMHSA document, and then that US Surgeon General's advisory document there, and then other research. And again, I'll have tons of resources for you at the end. I'll make sure that they get the slides to you all so you can have these readily available. But when it comes to prevention, and this is where I would really love to spend way more time, like another hour, unpacking how prevention science actually really does play a role at this intersection. But since I don't have that much time, I'll just say the strategic prevention framework is really how we base all of our work. When it comes to thinking through how we're assessing who's using social media, where are they using it? How often are they using it? What are they using it for? What drives young people to be online? Gathering assessment around data around all of those questions and more helps inform us of where we can start this process. We think about the capacity, we think about what resources we have available, how ready are we to start making some changes, and then we start to look at different ways that we can interact, which is what I'll get into in just a second. One of the key pieces here is thinking about risk and protective factors. A lot of things I shared with you already are highlighting risk factors that young people have in this space. We've also got to counteract those with things that protect them from the impact of these risks, protect them from the things that could harm them. So in creating this, I took a list of evidence-based risk and protective factors because we always want to use evidence-based methods whenever we are doing this kind of work to make sure that what we do, we know will be effective. So in looking at a list, I just pulled a couple of risk and protective factors out that I think really point to ways that we can start thinking about how to interact here. On an individual level, you've got this idea that young people may be more rebellious in nature, and that's a risk factor, versus maybe someone who's more resilient on the protective factor side. They're able to sort of work through tough things, and maybe they are bullied or there's something said about them. We've got to think about how we are protecting our young people and building that resiliency. Under that risk, maybe there's family management problems. That's like lack of monitoring, inconsistent punishment or consequences, family conflict that's going on in the home that might drive them to, online spaces. Access. One of our primary methods when it comes to substance use prevention is access. We try to reduce access through retailers, through social access. Well, when it comes to devices, we need to make sure that we've got good protections available that reduce access to young people. There are apps that are meant for just young people to be able to interact socially. My nephew, he's one of the 12-year-olds who has social media, but my sister's designed it so that it's only an app that is used by young people his age, and there are protections in place. And we both researched them together and decided that that was an app that would be appropriate for him to be communicating with his friends on. And we're looking at community and favorable norms. Like as adults, we're on social media a lot. We've already talked about it. We're almost setting the stage. We're setting this sort of norm of using social media as a time killer on our devices, scrolling when we just need a distraction. We're modeling that behavior for them. So, again, as adults, I think that we've got some space here where we can look at our behavior and how we might need to make some changes. But then, okay, flipping this line into thinking about protective, we've also got ways that we can bond with young people through mentorship, through positive, trusted adult relationships, giving young people positive opportunities for belonging. A friend of mine, Kim Laube, she runs a teen institute every summer for young people, and it's a weekend long retreat for young people. She has about 100 students who come. Guess what? When they show up in camp, their phones go in a bag. Parents have had a fit about it before, and Kim just says, sorry. It's the way we do things here. If there's an emergency, we will make sure that we contact you. But those students go without their phones for that entire weekend. It's powerful because then they have this opportunity to get involved, to get invested, to build relationships with young people. And for those of you who are my age and older, you remember camps when you didn't have a phone to rely on. You had to go make friends. And so this is a positive thing for their social development and all of that. And of course, recognition for positive behaviors. Now, if we had more time, I'd ask you to delve in a little bit more into ways we see risk and protective factors popping up in this space in the work you're doing. But we'll keep moving for the time period just to make sure that we do get to some of these recommendations. We want to use the 7 strategies for community change. They're evidence-based ways to make sure we make an impact here. And again, if I had an hour to unpack prevention science with you all and how we can do this, I'm hoping to just sort of wet your whistle with some ideas and some thoughts here that maybe can spark some change moving forward or some further work around this. But let's talk about specifics here. So ways to reduce risk factors and enhance protective factors. If you have young people in your life, talk to them about it. Ask them what their online behavior is doing for them. What's the impact? Do I know how to get out of uncomfortable situations if someone's, refusal skills and ways to navigate those conversations? Using news stories as points of conversation. Hey, did you hear about so and so and this happening? What do you think about that? Hey, I heard someone was bullied online to the point that they, whatever the story is. Encouraging youth, but also us, to set limits. And I'm just going to throw myself on blast here. I have tried to set app limits before and I just ignore them. Whenever it pops up and it's like, hey, you've been on Instagram for 2 hours today. I'm like, and I'm still on Instagram, so go away. And I usually ignore the notification. But you know what? Again, like I said earlier, awareness is everything about changing behavior. So setting timers, not using phones and devices after 10 p.m. Even something I mentioned, that eye strain early on, maybe we're changing from light mode to dark mode. I actually changed my phone across the board to dark mode. Now, when someone hands me their phone to look at something and it's not in dark mode, it's so aggressive on my eyeballs. So it's just like that small shift has definitely made a difference for me. Being that trusted adult that they can talk to about their online experiences. If they've saw a party that was happening, if they're feeling sad about being left out, being a safe person for individuals, young people to come and talk to is really, really key. And keeping up on what's trending is really, really important because it's kind of part of our role. We've got to know what young people are wanting, needing. And I just ask young people in my life, I just will ask them like, what's going on online? Or I've got my ears tuned to it so that I'm aware of what's going on, what could become an issue down the road. We want to normalize our own boundaries. I already mentioned that, teaching some refusal skills. And this next slide, there's a lot of words in this slide. You don't have to read all of them. This comes directly from one of the documents I'm about to share with you as a resource. And they're just conversation starters for young people that might be in your life. So just taking one of them, I know social media is important to you and I wanted to check in about it. How do you think things are going with your social media use? That bottom one, let's talk about gaming. I'd like to share a few things I've noticed about your gaming behaviors and then hear from you. I want to be on the same page. Now, those have to be the exact words, but the idea is that you're starting conversations with young people that bring them into creating their own healthy boundaries. Again, this comes directly from the document I'll share with you, but just some strategies for parents and caregivers, like building a family media plan. When do we use our devices? When do we not? Where do we charge our devices? What's happening with our Wi-Fi after 10 p.m.? Does it get turned off? All of these ways that we as a family unit are going to make some decisions together about our online space. When you do have conversations about social media, the recommendation to keep it a low drama part of the conversation, the family. normalize those boundaries again, teach safety skills online. Now, the keys here, those are very personal. We're going to shift to thinking about some professional recommendations in our last few minutes here. One is advocating for policies in the industry around algorithmic transparency, meaning what is the algorithm really tracking about us? And what does that then make them do that changes our behavior? They understand human psychology. They understand the human tendency, the brain's tendency for addiction. So the algorithm is literally giving us information that it thinks we want. And some of you may have experienced this where you watch one video that got sent to you, and now all of a sudden that person's account is popping up in your For You page. You're like, I never even followed them. Like, I don't even want to be seeing their videos. We've got to maybe have some transparency around how they're tracking and where they're storing that information about us, and especially about young people. I mentioned AI. This is again a different topic for a different day, but we've got to get some ethics around AI and ways that we are setting up some barriers there because there's some very, very dangerous things like deep fakes and things that are being created in a very dangerous space. Keeping individuals under 18 from having a public account. And man, listen, I've got one of my closest friends. Her daughter makes a couple thousand off YouTube every month. She's 16 years old. It would devastate her if her account had to get switched to private because she would stop making that money. But for the safety of a lot of people in terms of online exploitation exposure, this is another recommendation. One that I love on this slide is this last one. Start having school training in schools, like curriculum that's required on media literacy, helping young people navigate this space online. And I saw someone drop in the chat there about the no phone policies in school. My sister is a school administrator, and they made that change and that shift where phones have to be in the door, pockets and all of that. And so I think that some of those are really important conversations and policies to start thinking about and having changed. A few other recommendations here that I mentioned this already, banning targeted ads, keeping children under 13 off the platform. And with that, kind of like, how do we enforce age minimums? There's been some discussion about raising that minimum of 13 to 16. But the question becomes, how do we prove that? Are we all going to be required to issue a government document that says our birth year? And that's a big risk for people's privacy. And so a lot of question marks on the page there, but we've got to have that. Last thing to say here, just this is just for your own interest. Out of Missouri, Senator Josh Hawley actually was able to pass last August this KOSA Act, which helped to give stronger policies to those social media companies, stronger recommendations and stronger requirements for them in terms of their data policies to young people. So that's just information about that. Again, you'll have this information available to you. So as I land the plane in the last minute, my last thought here is just that we've got to be connecting with people. We've got to be connecting with young people, providing that protection. This online space may feel scary, but they need us in this space. We've got to occupy this space with young people and make sure that we show up as the best adults that we can with the most information that we have. Again, I've got 3 slides of resources here. These are the 2 that I want to point you to the most. That's that SAMHSA document. The Biden-Harris administration put together a task force that then created this 127-page document of recommendations for families and the industry around online children's health and safety. And then that document on the right is Dr. Vivek Murthy's 2023 document and advisory on youth, social media, and mental health. So given that, I'll get to my last slide here so that you all can jot down my email. I think Megan's also going to put it into the chat. And I'll hand it back over to Jody for any closing remarks on either CEUs or information, but loved being with you all here today. Please email me if you've got any questions or things that you want some resources on. I'd be happy to help.